crime. We will now have our last online statement from the Vienna NGO Committee on Drugs. I'm waiting for Mr. Mauro Patti.
Thank you, Chair. Distinguished delegates, I hope you can hear me. I'm honored to address this special event for the World Drug Days on behalf of the Villa Marini Foundation, part of the Vienna NGOC. Achieving the SDGs require significant improvements, particularly in providing access to treatment and enhancing the continuum of care. This involves fair, ethical, and person-centered therapy, from initial contacts on the streets to full recovery for people with drug disorders. Our mission is to promote the humanitarian approach worldwide to meet international commitments by advocating for its implementation in health, prevention, and criminal justice, such as deflection, diversion, and alternative to incarceration. We do it globally through the Rome Consensus 2.0 Alliance, a collaboration between the Red Cross and Red Crescent, professionals, NGOs, human rights activists, and academia. Our goal is to ensure that individuals in need of treatment are reached where they are, connected with health and recovery services, and provided with ethical, evidence-based, and compassionate care. This strategy not only enhances the well-being of affected individuals and their communities, but also reduces crime rates, overdose deaths, and save public funding too. The Villa Marini is the rehabilitation center established by Massimo Barra in Rome in 1976, recognized as the Red Cross and Red Crescent training centers on substance abuse. It has been at the forefront of this humanitarian approach and was pioneer of many evidence-based best practices, like the early intervention for overdose cases on the streets in the early 90s. That thanks to the former drug users was possible to save more than 3,000 people's lives just in the city of Rome, and was among the first to promote harm reduction programs as first step in the continuum of care. Every day we take care of more than 700 clients, supporting them from the street to the full recovery and rehabilitation, passing through the assistance in the prisons and also at the police station when someone is arrested and is in need of treatment. At Villa Marini, we provide many different health and social services under one roof. And we also engage Red Cross volunteers in prevention and sensitization activities within local communities all around the world. This vast experience we gained in the field allowed us to produce the necessary evidence to impact and improve on people's health condition. Those evidence that today are at the core of our discussion and should guide the drug policies of member states. Our holistic approach ensures that every individual receives the support they need at every stage of their recovery journey. By continuing to champion this ethics method, we can create a more human and effective response to drug use and address the gaps highlighted in this annual report. Thank you very much.
Thank the Vienna NGO Committee on Drugs. We have come to the end of the interventions.